Hello students, welcome to today's session on diet counseling techniques and guidelines. I am Dr. Guhapriya to present before you on the techniques and the guidelines on diet counseling. Diet counseling is a combination of nutrition expertise and psychological skills delivered by a trained dietitian. Diet counselor's role is no longer seen as a mere information dispenser, but rather as an agent for changing food and eating behavior for better health. Dietitians must focus on disease prevention in addition to the traditional responsibilities. Epidemiological studies have implicated the lifestyle factors such as changes in dietary pattern, lack of exercise, alcohol consumption, cigarette smoking, etc. in the growth of the chronic diseases. The solution lies in educating people to modify this lifestyle behavior. Having access to the patients and their relatives, dietitians must exploit the opportunity to give them adequate health and nutritional advice. They can dispel myths and misconceptions about foods, especially fats, by media reports and the advertisements. Moving on to the objectives. The objectives involve to understand the techniques involved in diet counseling and to learn about the stages and process of intervention and models that can be used. Let's see on diet counseling. Hospital dietitians could address large groups of patients attending clinics, outpatient departments on the importance of nutrition. Dietitian could prepare easy to understand leaflets on nutrition for distribution to the patients. The major objective of diet counseling should be to educate the patient regarding the nature of the disease, its hazards, and how it can be recognized and prevented. Advice on personal hygiene, individual instructions on diet, and any specific therapy are also needed. For effective dietary counseling, a team approach between the physician, dietitian, the nurse, and the patient should be encouraged for success in the diet therapy. A good rapport should be established with the patient. People or the patient should be made aware of the fact that diet plays an important role in the prognosis of disease and that they should strictly follow the guidelines of the diet therapy. Also, they should be encouraged for a regular follow-up program in order to maintain a sound health. Apart from food service, the diet clinic on outpatient service helps in wider use of dietary counseling and serves to extend and clarify diet instructions and have follow-ups. Whenever possible, home visits may also help in ensuring the adjustment of the patient to the home environment. Programmed instruction through booklets, food models, charts, and other audiovisual aid merit the attention due to their great impact and flexibility of use for many kinds of people. In food clinic or health center, group therapy may also be used with advantage for such groups as pregnant and lactating women, women with preschool children, diabetic patients, weight control groups, and so on. Let's move on to the non-compliance to the diet advice. Large proportion of patients fail to adhere to diet advice, exercise, glucose monitoring, and thus leading to the risk of complications. Some of the possible reasons for non-compliance is as follows. Primary care providers do not consistently provide counseling to their patients. The patients are not referred for nutritional counseling. There may be resistance to change of the diet, competing time and the energy demands. Genetic characteristics may have greater effects, and lack of relevant educational materials may also be the reason. Diet therapy is infrequently prescribed in some cases, and there are changes required on the lifelong, so the lifestyle need to be changed, so that in turn affects the compliance. Family cooperation may be inadequate. The impact of nutrition counseling is not dramatic, and those who do not have patience may stop compiling. And the festivals and party occasions may disturb the schedule. Special effort has to be taken when the patient eats outside the home in the restaurant or relative's place. Patients who work long hours in the working place may not comply with the dietary advice. When educating patients about the disease, the dietitians must first treat any existing depression and take into account the patient's education level and cognitive ability. Usually, older the patient and the longer the duration of the disease and the treatment, the better is the compliance with the dietary guidelines as well. Primary healthcare personnel need to give due importance to the diet and exercise. Dietitians should focus on providing dietary alternatives for the married and working patients. They can suggest ways of modifying the family diet according to the patient needs. Counseling techniques is very important, and the main objective of counseling is to bring about the changes that need to be made. People are motivated to change through their ability to self-manage behaviors. The nutritional counselor sets up an environment that is a transient support system to prepare the patient to handle social and personal demands more effectively while providing favorable conditions for change. Different strategies may be used to offer guidance. One style is cognitive behavioral therapy, which assumes that thinking affects behavior, that relevant beliefs may be identified and altered, and that desired behavior change may be achieved through changes in thinking. Motivational interviewing, initially developed for addiction counseling, has increasingly been applied in public health, medical and health promotion settings. By using these techniques, the counselor can help the patient move through various stages of change. This helps the client recognize and do something about concerns and problems. The client is responsible for making the change. The goal is to increase the client's intrinsic motivation so that he or she can express the rationale for the changes. Persuasion and support are key elements of this style of counseling. Concepts to consider in facilitating dietary changes. People make behavioral changes only when they are ready to change. The nutrition intervention, including both the content and nutritional style, is a powerful determinant of resistance and denial, as well as motivation in persons who want to make changes in their diet. People cycle through different phases of changing and maintaining their dietary modification. Different interventions are needed for persons who are in different phases of motivation. Ambivalence is a key block that can be resolved through intervention. Resistance and denial get in the way of meeting behavioral goals. The stages of change are as follows. The trans-theoretical model, also referred to as the stages of change model, describes behavior change as a process in which the individuals progress through a series of 6 distinct changes in a stage-wise. To begin with, pre-contemplation. This is the point at which the patient has not even contemplated having a problem or needing to make a change. A person in the pre-contemplative stage needs information and feedback to raise his or her awareness of the problem and possibilities of changes. Nutrition advice from eating changes is counterproductive at this point. Moving on to contemplation. Once some awareness of the problem arises, the person enters a period of ambivalence, the contemplation stage. The contemplator seesaws between reasons to change and reasons to stay the same. At this stage, the counselor works with the patient on advantages and disadvantages of making dietary changes. Moving on to preparation. The preparation stage is a window of opportunity that allows the patient either to move forward or fall back into contemplation. At this point, the patient needs help in finding a change strategy or goal that is acceptable, achievable, and appropriate. Moving on to action. The patient engages in actions that bring about change. At this point, the goal is to produce a change in the problem area. Moving on to maintenance. During this stage, the challenge is to sustain the change accomplished by previous action and to prevent relapse. Relapse. If relapse occurs, the individual's task is to start the change process again rather than become stuck in this stage. Slips and relapses are normal, expected occurrences as a person seeks to change any long-standing pattern of behavior. The goal is to resume action efforts. Traditional nutrition counseling focuses on the change process matched to the action and maintenance stages. This works well for persons who are actively trying to make behavioral change. However, most persons who have problem dietary behavior are in pre-action stage that includes one of the following: pre-contemplation, contemplation, or preparation. These persons are not yet ready to change. The traditional approach, which assumes that the patient is already in the action or maintenance stage, doesn't meet the needs of many and may be one of the reasons to lack of success in long-term maintenance of many intervention programs. Moving on to the activities that facilitate change, a variety of principles are important when determining what facilitates change. The following are important when working with persons struggling with change. Expressing empathy. Counselor acceptance of what a patient feels in times of turmoil can often result in change. Acceptance facilitates change. It is also a skill form of reflective listening, which would allow people to describe their thoughts and feelings, while the nutritionist reflects back under their understanding. Many people have no one to talk to about problems in their lives. This opportunity to have someone listen and really try to understand the emotions behind the words is crucial to eventual dietary change. As most people talk about their lives and lack of time for dietary changes, the counselor will hear ambivalence. On one hand, the patients want to make changes. On the other hand, they want to pretend that change is not important. Ambivalence is normal. Understanding the cultural factors is very important. The effective culturally specific nutrition counseling is dependent on sensitive communication, the strategies. Changes in eating behavior, habits can be affected by what is valued. The nutrition counselor should be familiar with the cultural norms regarding indirect and direct questioning, formality or informality, eye contact, and individual space. Moving on to developing discrepancy. An awareness of consequences is important. Identifying the advantages and disadvantages of modifying behavior or developing discrepancy is a crucial process in making changes. Avoiding arguments and defensiveness is also very required. Arguments are counterproductive. A counselor urges may lead in the direction of defending one's own ideas, but the result is frequently defensiveness on the part of the patient. When a patient resists, this is the signal to the counselor to change the strategies. Moving on to rolling with resistance. The counselor can invite new perspectives without imposing them. The patient is a valuable resource in finding solution to the problems. Perception can be shifted, and the counselor's role is to help with this process. When it becomes acceptable to discuss resistance, the rationale for its original existence may seem less important. Moving on to supporting self-efficacy. Belief in the possibility of change is an important motivator. The patient is responsible for choosing and carrying out the personal change. Hope exists when there are alternative approaches to a problem. To be effective, the intervention requires careful planning by the counselor. The intervention module. The first step is that in an intervention is interviewing. Skills in knowing how to elicit information about the eating habits are important as the assessment of patient's diet proceeds. The key to obtaining Vital information that will later dictate treatment strategies involves initializing, establishing a counseling relationship. Interviewing. The purpose of the client interview is to obtain information. A series of questions are asked in a non-threatening manner to obtain background information that will guide the session. The first session is an important time to establish the counseling relationship. The environment should be conducive and privacy, and there should be a plan for reduction of interruptions. Communication skills and the body languages are also very important. To make these stages of change model less complicated, an alternative is to view the stages in terms of 3 phases. First, not ready to change, considering meeting the goals, ready to change. To identify which of these 3 stages a patient is in, it is important to assess the patient's situation. Moving on to assessment. The purpose of assessment is to identify what stage of change the patient is in and to provide appropriate help in facilitating the change. The stage of readiness for change should be assessed and documented. Then establishing rapport. To build rapport, one begins by asking one or more questions that are relevant to important aspects of the participant's life. Assessment of current eating behavior. Determining the present eating habit provides ideas about how to change in the future. It is important to review self-monitoring tool to assess where the patient sees his or her adherence level. Food diaries help to identify eating habits and potential modifications. To elicit responses from the patient on the ideas about where changes in the diet need to occur, it is helpful to provide feedback on the patient's progress towards a goal. Moving on to assessment of a readiness to change. At this point, it is important to assess readiness to make additional changes. 3 possibilities for readiness exist. 1. Not ready to change. The second, unsure about the change. Third, ready to change. These 3 concepts of readiness have condensed the distinct stages of changes described in this chapter to assist the counselor in determining the level of patient readiness. First, not ready to change. To approach the not ready to change stage of intervention, 3 goals are the focus. First, to facilitate the patient's ability to consider change. Second, to identify and reduce the patient's resistance and barriers to change. And finally, to identify behavioral steps towards change that are tailored to each patient's need. To achieve these goals, several communication skills are important to master. Asking open-ended questions, listening reflectively, affirming, summarizing, and eliciting self-motivational statements. Asking open-ended questions. Open-ended questions allow the patients to express a wide range of ideas. Closed questions can help targeting the concepts and eliminating the tangential discussions. For the persons who is not ready to change, targeted discussions around difficult topics can help focus the session. Moving on to reflective listening. Nutrition counselors not only listen but try to tag those feelings that surface as a patient is describing difficulties with the eating pattern. Listening is not simply hearing the words spoken by the patient and paraphrasing them back. Reflective listening involves a guess at what the person feels and is phrased as a statement, not a question. By stating a feeling, the counselor communicates understanding. One also more fully understands the patient by labeling a feeling. Moving on to affirming, counselors often understand the idea of supporting a patient's effort at following a new eating style but do not put those thoughts into words. When the counselor affirms someone, alignment and normalization of the patient's issue occur. In alignment, the counselor tells the patient that he or she understands and is with him or her in understanding difficult times. Normalization means telling the patient that he or she is perfectly within reason and that it is typical to have such reactions and feelings as well. Summarizing, the counselor periodically summarizes the content of what the patient has said by covering all the key points. Simple, straightforward statements are most effective even if they involve negative feelings. Moving on to eliciting self-motivational statements. The 4 communication strategies are important for eliciting self-motivational statements. The goal here is for the patient to realize that a problem exists, the concern exists about it, and that positive steps in the future can be taken to correct the problem. The goal is to use these realizations to set the stage for later efforts at dietary changes. Moving on to ending the session, counselors often expect a decision and at least a goal setting session when working with the patient. However, it is important at this stage to realize that traditional goal setting will result in feeling of failure on the part of both the patient and the nutritionist. If the patient is not ready to change, respectful acknowledgement of this decision is important. Unsure about the change, the only goal in this stage of change is to build readiness to change. This is the point at which big changes can occur. This unsure stage is the transition from not being ready to deal with the problem eating behavior to preparing to continue the change. One crucial aspect of this stage is the process of discussing the thoughts and feelings about the current status. Moving on to the ready to change. The major goal in this stage of change is to collaborate with the patient to set goals for change that include a plan of action. The nutrition counselor provides the patient with a tool to use on meeting nutritional goals. When a counseling session begins, the patient is most often assumed to be in the stage of change. To assume erroneously that the patient is in this stage means that all the strategies used to make a change are misused. The assumption that the patient is in the stage often results in a lack of adherence on the part of the patient and the discouragement on the part of the nutritionist. It is initially important to discuss thoughts and feelings about where the patient stands relative to current dietary change status. Use of open-ended questions helps the patient confirm and justify the decision to make a change. In this stage, goal setting is extremely important. Here, the counselor helps the patient to set a realistic and achievable short-term goal. Action plan. After goal setting, an action plan is set to help the patient map out the specifics of what must be done to achieve a goal. Having supportive people around to help with dietary adherence is important. Early identification of barriers to adherence is important. If barriers are identified, plans can be formed to help eliminate those roadblocks to adherence. Many patients fail to notice when a plan is working. Make sure that the patient knows when the action plan is a success by asking the patient to summarize the plan. To summarize on the dietary plans and guidelines, facilitating the dietary self-management in patients involves knowledge of where they are in regard to their willingness to change. In facilitating change, nutrition counselor should tailor the strategies to each stage of change. Successful change interventions lead to satisfying outcomes for both the counselor and the patients as well. Hope the session was useful. Thank you.